window. There we go.
Hi, everyone. Henry DeVries with Health Authority TV. And this is the TV show where we look at health advisors, health B2B, all those people who help raise the money and fund and provide the technology for better health. And I have a health authority with us today, Rachel Braun Scherl. Rachel is an author. How are you today, Rachel?
I'm great, Henry. How are you?
Very fine. Why don't you tell them about your book and your work?
Okay. So the book sprung from the work that I've been doing for decades, which is around driving top line growth for women's health companies. And for those people who are in the space, this will sound familiar, but the current definition of women's health are things that affect women only, primarily, or differently, meaning only you have the biologically female organs. Primarily means they're not necessarily female in nature, but women have a much higher prevalence. That includes things like autoimmune, breast cancer, migraine, lupus, dementia, fill in the blank. And then the last one is things that affect women differently, which is the biggest example is cardiac disease. And I was working in this space and was raising money when I had the chance to meet you, Henry. And I wrote a book called Orgasmic Leadership, Profiting from the Coming Surge in Women's Sexual Health and Wellness, which was meant to describe how do you capitalize on existing business trends to build businesses in this space, in this women's health space. What was changing in terms of technology, what was changing in terms of distribution, what was changing in terms of personalization. And when I say technology, I don't just mean computer technology, but materials technology, and as I said, distribution technology and technology around marketing and all these other things that change so rapidly. And I to do the book, I had done about 3 dozen interviews with investors, healthcare practitioners, founders, payers, thought leaders in the space to say, here are some real examples. Here's what I learned. Here's what dozens of other people learned to figure out how to sort of slay this big beast, which is women's health.
Or take advantage of this enormous opportunity.
Yeah,
Um,
I'd say, yeah, slay this beast, meaning solve the puzzle that has been eluding us, which is how do you get women's health companies funded? How do you get women's health research paid for? Women's how do you get money in the right hands of the people building these businesses? Because it is old news. We hear it every day at every conference and every conversation that I'm in that women's health is underfunded, under-researched, and misunderstood. And all of those things are true, but it's getting better every day because there are so many people who are concerned about this.
well, I'll tell you, it was eye-opening for me because I thought we had moved beyond so much and uh, we were in this new era. But being in this fight with you, and you intentionally chose to be a disruptor, to be provocative, and the media wouldn't accept your money for commercials. I couldn't get publicity. There was normally a slam dunk for a book like this because it was.
And I don't know if you recall, Henry, but I was asked and did speak at a number of places where, they filled the room with hundreds of people and they wanted to hear my perspective on women's health, but I couldn't share the title of the book.
Right. It's yeah, yes, it's
We
like,
have gotten better
can
since
you
then.
say the word penis? It's like, could you say, but yeah, but you better not say the V word. It's just
Well, when we've seen forever, we're
ludicrous.
now in our fourth decade of a world with, 4-hour erections. And listen, when it comes to health education, I'm a believer that let people have the information and then decide what to do with it, as opposed to decide what information they're actually allowed to have.
Wow, that's pretty radical. He said sarcastically. Yeah, that we should count on people's intelligence and let them. I'm sorry, Sue. I come from journalism, and I come from the First Amendment. Is the prime directive above all else, and that information should flow freely, and you know. people should be able to decide things, but that was not the case. That was not the case in your and has there been progress in the interim?
Yeah, absolutely. So, Henry, what you're referring to is when I was launching my first business in the space, my business partner and I went out to 100 media outlets and we had very tasteful, talking head, sort of informational, educational ads
Yeah.
about women's sexual health. We weren't simulating anything. There was no,
No
sexual
graphics, no diagrams.
overtones. Yeah, no
Yeah.
diagrams. And yet 95%, actually, it turned out to be actually the number 95 of those outlets said, no, we won't take your money to put your ads on. And that was radio stations, TV, network, cable, online, whatever the case
Yeah.
was. They said, this is too controversial. There have been lots and lots of companies who have done this, what I call, having to fight City Hall. There have been, many famous examples of companies that have fought and won the right to advertise in certain places. There are two companies, one here and one in Europe, Center for Intimacy Justice and Censorship, who have done really expansive surveys with founders, asking them how frequently they've run into this issue where their ads have been blocked, and even worse, when their channels have been banned. And, there's still a large number. We are making progress. As a community, we've raised the issue. We've given it a lot more airtime and shined a light on it. There are large companies that say their policies are still different, and people have figured it out, but it's at great cost um, from a financial and resource perspective. And the problem isn't totally solved yet. We've made a lot of progress, um, but once a day I hear from a founder who couldn't get an ad through.
I'm going to go to the opinion question. At first, I'll say, by the way, they were taking Cialis monies with people in bathtubs looking at the sunset. So it wasn't sex that they were
It wasn't
against.
sex.
Yeah, it was
And sort of
women enjoying it, I guess. I don't
the
know.
hypocrisy really was there is much greater comfort with the over sexualization of women. So not to put down a lingerie company, but let's take what was the world's biggest lingerie company at the time. Victoria's Secret was showing a lot more and leaving a lot less to the imagination than, these women's health companies trying to come up with solutions for an array of women's conditions. But we are socialized to be comfortable with that.
Um, you went on to advise some major organizations on women's health. Could you just share some of that work?
Sure. So I've done work. I started my career after business school working for J&J and then spent decades working for companies like that. So, multiple divisions of Johnson and Johnson, Pfizer, Merck, Bayer, AbbVie, which used to be called Allergan, Church and Dwight, Reckitt, a number of startups and companies that are much further along in their development that you would know that have been built in the last 10 years, covering anything from menstruation, incontinence, disease prevention, fertility, infertility, menopause, the 17 million symptoms of menopause, heart disease, so lots and lots of companies. And it's really exciting to see what's happened. One of the things we're seeing now is there's so many people talking about so many aspects of women's health that we're now seeing consumers have to step back and, they're a little bit confused about what to believe. There's so much information. Where am I getting the validated right sources of information? So, we're taking many, many steps forward, and every once in a while we take a step back. The biggest issue that we face right now, in my mind, in women's health is the disparity around reimbursement, which I could talk for days about. But just to put it simply, there is research, documentation that anatomically equivalent procedures that require similar training to be done on a man versus a woman, so tubal ligation versus vasectomy, that on average, the doctor performing that procedure, male or female physician, performing it on a male patient is reimbursed at 30% higher than the caregiver performing it on a female patient. So there's just, and if we can't figure out how to pay people to deliver this care in a meaningfully, economically sustainable way, and we can't figure out how to deliver this care to the patients who need it, we're never going to get out of our own way. So reimbursement is a really critical issue that lots of people, myself included, in this space are working very hard on right now.
And when you come to the issue late in the game, um, you get really angry. That's like because let's say, like, well, you're not female. Yes, I have a wife and daughters, and my wife and I were somewhere. She goes, well, why does this, it was this in the store? I'll just say, why does this cost 25% more for me than the one for you? I said, oh yes, the female tax.
The pink
The
tax, yeah.
female tax, yeah, they charge, the pink
So,
tax.
so what's
We're too.
interesting is, about the anger. This is something I talk about all the time, and I talk about it when we're teaching an MBA course in women's health, is I have what I call good women's health mental health days and bad women's health mental health days. So sometimes, the anger gets better of me. Most days, thankfully, it doesn't, but there is a lot of frustration. You have to really be in this for the long haul. And
Yeah,
once you get
yeah.
in it, regardless of what you knew before, you are very quickly schooled in this is a different world. There are idiosyncrasies around being in women's health and building companies that are different. That doesn't mean everything's different, but there are many, many fundamental things that are different that you need to understand if you're going to stay in the game long enough to build a women's health company or multiple women's health companies.
Well, all those organizations you work for, I would call those major league. You're in the major leagues, advising and teaching and consulting. Um, and I'm a fan. I've written about you and your work. I
Thank
wanted
you.
to
I
get your
appreciate
opinion
that.
today. Oh, well, my honor. Or as they say at Chick-fil-A, my pleasure. Um, I want to get your opinion on what can we do to improve healthcare in the United States?
Are we turning this conversation into a sleepover? So,
Shit.
I mean,
Let me get my jammies.
yeah,
Okay.
take your pick. I would start with reimbursement. I think that the fundamental, I'm part of building this company called 51 which is a tech-enabled, membership-driven platform so that we have an annual fund of money, 80% of which we can put back into the ecosystem to really make changes in infrastructure. So we need investment in women's health. There's decades, literally decades of fundamental women's health research that doesn't exist. We haven't analyzed all the data that we do have with sex specific differences. We're not paying for these. We talked about the reimbursement issue already. I mean, take your pick. It's in the funding of these companies. It's in the fundamental science supporting these companies. It's in the requirement of, what clinical proof is needed, and even if you design the right study, will it be reported in a way that supports what you're trying to demonstrate? We've done a lot of things much better. There's lots of people talking about this. No, we don't feel like we're shouting in the wind, but take your pick: better funding, better research, better reimbursement. Those are three things we need to make healthcare better. And it's not just bad for women. I mean, it might be, exacerbated for women. But, what we saw during COVID is that when the health of the woman of the household suffers, everybody suffers. We saw that. We saw the financial impact. We saw the impact on the health of the family and the ability of the family to, continue to earn a living and for children to continue to be educated. I mean, the whole system sort of falls apart. But the primary thing I would suggest to anybody is understand that to get good health care, you have to be your own advocate. You might like to go in and not have to tell anybody anything, but if you have 7 to 15 minutes with your doctor in your average annual visit at an obstetrician gynecology annual exam, you have to know what you're going to talk about because there is no way that the way the system which is set up, which with insurance only enables many doctors to spend 7 to 15 minutes with you to discuss what's happened to all your systems in the past year. You really need to be on top of your health in a way that I don't think we necessarily had to do before. We now have more information, but the information sources aren't necessarily talking to each other. We have lots of ists, as I say, gynecologists, dermatologists, endocrinologists, cardiologists. And, it's up to us to bring all that information to bear so that we can advocate and we have the information for our health. So you have to be incredibly involved. This is why, for people who have aging parents, um, we've we've never had a situation in my own family where one of our parents went to a physician without one of my sister or myself being there. There's so much information and it's so overwhelming. And if you don't have technology on your side, which lots of people don't understand how to record the calls or do all the things that are common nature to us at this point, you really you have to work hard at your own health. You have to know what to do. You have to track. You have to be informed. And then to get to the other end of the spectrum, doctors don't have the time, nor are they prepared for the reams of data that patients now can bring in, with all the information they get from their wearables. So we have, in certain cases, not enough information, and in other cases, too much information. And we're sort of just throwing it against the wall and hoping something sticks, and it's clearly not working.
Whoa. Again, this could be a sleepover. I just came from covering the Sway Health Conference up in Boston, and this was, AI is on everybody's mind, but was really the payment structure and how totally, pardon the technical term, screwed up we are in this area.
And
So
it's screwed
thank you
up
for
for
being on.
everybody. Most physicians have the best of intentions. They don't like working in a broken system. They want to deliver good care. Most patients don't want to be that problem patient. They want to get their problem solved. They want to have a doctor that they can trust. And most doctors, all doctors, want to get paid for the work that they do. And the insurance companies have the right to know what treatment was provided. So they're paying for the accurate stuff. So no one's winning right now. I mean, the insurance companies obviously are making a lot more money. And, there's always a discussion about the pharmacy benefit managers having too much control, but it's not working for anybody if our ultimate objective is to improve health outcomes and improve the percentage of people who are living healthfully, that are not just living longer.
Rachel, I can't do the sleepover today, but I'd
Yeah.
like to have you come back another time.
Thanks
This
so
has
much.
been
I always love
very
talking to you. And
helpful.
once you throw me a bone, Henry, I'm off to the races.
Oh, and I didn't even throw, I'll say, I didn't even throw the grenade into the room on you yet to really get you going. When you have a relationship like ours, we know where the buttons are. So,
Right,
yeah,
exactly.
we don't, thanks for not
You
pushing any
have
of
the
mine
eject
either.
button if you need it, Henry.
Okay. Okay, so until next time, uh, keep all those people healthy, wealthy, and wise.
Doing my best.
Thanks.